Yeah, so my project was part of my doctorate thesis. So yeah, I guess following on from speaking with Annabelle, who supervised me alongside this project, as well as kind of other members of the Making Positive Move project, including Helen and Louisa. So yeah, from kind of Annabelle's project, we thought it'd be really good to look at a different perspective. So yeah, my focus was from the health and social care professional perspective on kind of what their experiences were of supporting individuals with learning disabilities to move out of hospital back to the community via transforming care. So I guess kind of thinking about why this topic was chosen. So similar to what other people have said, the literature was really limited into this area. So I did a kind of full review of all the different research that looked at the discharge process under transforming care. And there was really kind of only about 13 research studies out there looking into this. It sounds great that today we've heard some of more literature that's going to be published, hopefully, which will be great. So yeah, it was really limited, and especially kind of the voice of health and social care professional perspective, in particular thinking about community health and social care professionals. So I think a lot of the research focused on healthcare workers that's worked in inpatient settings or hospital settings, but actually those in the community, that voice was missing. And it was felt that health and social care professionals do make a lot of big decisions about the lives of people with learning disabilities. So we felt like it was a really important focus to kind of look into. So thinking about what we did following this. So our recruitment for this study involved a leaflet that was sent to kind of the professional network. So anyone that we kind of had connections to who worked in kind of community or healthcare teams or social care teams who may have supported someone to move out of hospital via transforming care. And we asked if they would get in contact to take part in an interview for about 60 minutes about what their experience was of being part of that role. So who kind of took part? So we had 15 people in total. 12 of these people were healthcare professionals, and they consisted of kind of psychologists, occupational therapists, speech and language therapists, nurses, behaviour specialists, and forensic practitioners. So we had quite a range of, yeah, I guess an MDT focused, yeah, multidisciplinary team. So a real kind of representation of different kind of health professionals that work in community teams. And we also had 3 social workers who took part, which was great. And everyone who took part was in a community team. So this again varied. So we had people who were in forensic teams, community learning disability teams, and also people who worked in intensive support teams. And people that took part were in different parts across England. So we had people who took part from Surrey, Hampshire, Essex, Leicester, London, Kent, and some people also, they were commissioned to kind of work all over England. So I guess from the interviews, what happened next is I kind of analysed the data and pulled out kind of key ideas that she then developed into a theory. So we used grounded theory as the choice of analysis. So we had 4 kind of ideas or concepts that appeared, and these are kind of trying to move my screen so I can read. So the 4 main ideas occurred that was kind of balancing different levels of the system. So the people who were involved in a wide system of supporting the move from transforming care. Professionals kind of spoke about providing the opportunity to thrive again and wanting individuals with learning disabilities to kind of have this life in the community, which I think other people like Annabelle and Olivia have kind of mentioned in their research. Participants of the health and social care professionals spoke about sometimes feeling stuck working within the system. And I guess the title of my project was kind of the fact that doing and supporting people with learning disabilities to move from hospital to the community is not easy work in the system. So I'm going to kind of go into these 4 main ideas in a bit more detail to talk about what came up in the interviews. So when we talk about kind of balancing the different levels of the system, so the health and social care professionals spoke about 3 kind of different levels that were involved in the system. So this being kind of the individual with learning disabilities who was moving from the hospital to the community, the family and the carers that were around the individual, and the professionals who were involved in the discharge process. So whether that be kind of people in the hospital, also people in the kind of new placement, and yeah, kind of the health professionals in the community teams. So at the kind of individual level, so the person who was moving, the participants spoke about the importance of kind of having a balance of when to involve the individual at different points of the discharge process. So all the participants spoke about kind of how important it was to hear the individual's voice, and that included kind of at different stages. So in terms of asking kind of what community placement they would like, kind of finding out what's important for the individual to have in the community, and really kind of knowing the individual and what's important to them so that they can yeah, hear their voice and find a placement that meets their needs and what they would like. However, participants did recognise that sometimes too much information could be overwhelming for an individual. So especially when kind of placements were found, but then due to other circumstances, they might not have been suitable, or they perhaps, I don't know, they couldn't recruit staff, or it didn't end up being suitable. Kind of going back to the individual and communicating that could be really overwhelming from their experience. So yeah, participants spoke about kind of finding that balance of what could be shared, and also holding in mind the individual's voice as well. At the family level, so participants spoke about the importance of family being involved in the individual's decisions about discharge. They found that by having family members in the meeting, in kind of discharge meetings or meetings about that involved decisions about the individual's care, it was really reassuring to have families, and keeping them updated was really helpful. And they also found that having the family's voice in those meetings, it helped to kind of bring knowledge about the individual and kind of making best interest decisions as well. And also they found that family were really big advocates for the individual, and kind of making sure that in the discharge process all their needs were kind of thought about and met. There was also kind of managing expectations. So participants spoke about kind of sometimes the difficulties of having kind of this ideal community placement for an individual, but actually kind of working in the remits of what was available. And it was kind of working with families to kind of manage kind of what expectations are we expecting from each other, and trying to find again kind of that balance of you know, what can be provided and what's available. And I think many of the participants spoke about how difficult that could be. And then I guess at the professional level, so participants spoke about how important it was to work as a professional network and to coordinate discharges. So they all recognised how important it was to kind of have different disciplines around and different kind of professional knowledge coming into those meetings. And they also recognised the importance of how the kind of professional teams needed to be committed to come into meetings. Many of them spoke about the difficulties of when people didn't turn up, actions weren't completed, and how challenging that can be to move forward with discharges if those things aren't completed. Also, many of the participants of the health and social care professionals felt they took on roles where they had to at times be that voice that held people accountable to say, you know, you said you were going to do this action and it hasn't been done, and we need to do that. So there was kind of a lot of focus around kind of driving that discharge forward. The next kind of idea that came about was providing the opportunity to thrive again. So participants felt that they had a kind of responsibility of creating a new way of living for the individual who was moving from hospital to a community setting, and they felt kind of a level of pressure of kind of not wanting to let the person moving down. So they wanted to make sure that the move kind of was successful, and they felt like that responsibility was on them. So under kind of the idea of creating a new way of living, ideas that appeared was kind of hopes for individuals moving to have a good quality of life, and they wanted to allow the individual to have their freedom back after kind of acknowledging that the restrictions of a hospital environment. And in order to do that, participants felt that it was really important to spend time to know the individual that they are supporting well enough so that they can find a suitable placement with staff who could meet their needs, as well as thinking about things that they could do in the community and knowing their interests and activities that they could help to create this new way of living. Also, many of the participants spoke about making sure to communicate with the individual about things like how they'd like their bedroom, what kind of decorations to help kind of make that homely environment, which may have been missing from the hospital. The next idea came about was kind of not wanting to let the person down. So many of the health and social care professionals spoke about wanting to support the individual with learning disabilities to transition successfully back to the community, to avoid kind of any placement breakdowns and kind of returning to hospital. So participants spoke about kind of the need to get that right. So kind of reflecting on how many people may have been in hospital for many years, and hospital may have been seen as kind of a safe place for some people. So that transition can feel quite challenging and difficult at times. And so participants felt that they had to make sure they got it right. So thinking about careful transition plans, making sure that they passed on all the information, and also kind of working at a manageable pace. So that included things such as like building up the transition. So it might be visiting for a day, visiting overnight, and gradually transitioning to the new placement in a way to kind of make sure that that move was successful. The next idea was kind of feeling stuck working within the system. So kind of participants spoke about some of the difficulties of working kind of under transforming care. And again, kind of going back to what I said at the beginning was kind of the how they can work and the expectations of the system that they're working in, and how they can provide for the individual under that. So kind of having to fill the gap. So some of the health and social care participants spoke about kind of having to go out and work outside the remit of their role sometimes. So this quote here says, "We always go above and beyond and take on more than we probably should." So participants felt that at times they had to work outside of maybe their occupational therapy role or their psychology role to kind of fill the gaps of professionals in the system, and to make sure that that discharge was moved forward. So sometimes people felt that maybe they were going out and finding an appropriate placement for the individual, but they that maybe wasn't, they didn't feel like that was their job. So kind of having to fill that gap at times. Also, many of the participants spoke about kind of taking on roles such as kind of preparing the new staff team. So they're thinking about the support workers and the care staff in supported living or residential settings that the individual they were supporting to move from hospital. Preparing the new staff team. So that involved kind of supporting the new staff and maybe passing on information, doing kind of training sessions to support the new staff. And even after discharge, the participants felt that their role was to stay involved and to be a support network for the staff team as well. So this is a quote that from one of the participants that said, "The good services are few and far between." So participants kind of reflected on the fact that some participants were ready for discharge from hospitals, but actually trying to find an appropriate placement was really, really tricky. So this quote, "They might be ready for discharge, but there's just no placement found." So many of the participants spoke about kind of the impacts that has and how difficult it is to then kind of carry on with the discharge process if an appropriate placement can't be found and the limited options available. And alternatively, sometimes there was a placement found, but they can't recruit staff. So kind of support or care staff, although the most perfect building might have been found in an ideal location that met the individual's needs, they couldn't recruit staff, which I think is another kind of challenge of feeling stuck, essentially, that the health and social care professionals felt. And I think as well there was the aim for individuals to live locally. So many of the participants spoke about how one of the aims of transforming care is to individuals to move back to kind of where they were living before, where they want to live, but actually sometimes that wasn't possible because of the lack of placements available and staff. So and then they spoke about the difficulties of then having time to coordinate a move out of area, working kind of with systems that is not well known to them, working with community teams who they don't have relationships with, and how difficult that can be. Another thing that kind of came under this idea was I think they are burned out. So I think the participants reflected on kind of the really challenging work of a support worker. And I think one of the future studies that Annabelle just spoke about is kind of thinking about, I think she put it in the chat, about the support worker perspective of what it's of their experiences of supporting someone to move from hospital to a community placement. And I think some of the participants kind of reflected on the fact that sometimes when an individual moved from their community placement into a hospital setting, the participants felt like that was kind of maybe breathing room for the support staff. And it was, they kind of reflected that maybe that they, didn't feel skilled enough to take individuals back to their community placement, which then meant the individual moved to another community placement and had to kind of start a transition. And they just wondered whether kind of they wished people were more believing. So I think a lot of participants spoke about how sometimes on paper, individuals in hospital, all the paperwork is presented in kind of, here's a risk assessment, here's a portfolio of the individual, but actually it didn't represent the individual, kind of who they are and their personality and things like that. And participants kind of spoke about wishing there was more ways that they could communicate the individual as the person that they are, rather than the person kind of on paper from the hospital. And also, I think participants reflected on that, how sometimes in support settings that there's kind of inconsistencies in the support available from staff. And again, I think that comes back to participants are kind of saying that comes back to the fact that they are burnt out within their role. And finally, this theme kind of speaks about the decision making feeling like out of the professional's control. So the participants spoke about how sometimes they would be wanting to make decisions, but this feeling like it wasn't down to them. So this quote, there's a slowness or unwillingness to take risks about discharging people. So I think many of the participants spoke about there being a level of risk still and trying to manage that in the community, rather than saying an individual isn't ready for discharge. And there was kind of that wish for people to take more positive risks to discharge individuals back to the community. Also, participants spoke about sometimes the difficulties of securing finances. So there would be perhaps discussions around who was funding things, and funding would be in place, but then the cost of something would change, the whole funding process would have to start again, which then kind of delay the discharge for the individual. But those decisions kind of being out of the professional's control. So the final kind of theme, I'm aware of the time, so I'll quickly rush through this, was kind of that it's not easy work. So I think, so participants kind of reflected that if they weren't doing it, these people would just be an institution. So people kind of reflected on the hard work that they were doing to kind of push this discharge process forward. But actually, the staff actually felt that their there wasn't any thanks or praise for what they were doing. People kind of felt undervalued in their roles. And when there was a really kind of difficult discharge process and it was lengthy and find a lot of work went into it, it was kind of professional. The participants kind of felt it was well done, let's move on to kind of doing something else. And there was no kind of recognition for that. Also, participants felt that they were kind of the glue in the system sometimes and having to hold the whole network together to coordinate the different stages. Many of the participants felt that they were under pressure. So they felt under pressure to respond to kind of the policies and procedures of working under transforming care. They felt that there was a pressure to kind of get people out of hospital in a timely manner, which kind of put pressure under them, especially kind of going back to the last kind of concept and ideas about when the placements weren't available, there was still this push to kind of get people out of hospital. And also they kind of felt that they needed a good supportive network around them to kind of work within this role. And finally, there was kind of participants recognised the emotive side of working under kind of transforming care. So the quote, there's obviously a lot of emotion. So one participant said, I felt awful kind of when a discharge kind of broke down and the individual ended up back in hospital. And although they could kind of reflect on maybe changes, and I guess that's what a lot of my project kind of looked at, they still spoke about kind of how they felt working under transforming care and supporting individuals to move. However, on the other side, people kind of said that when things went right and the individual moved into the community successfully, they felt like it was really grateful to see the individual in the community. So I guess future recommendations, I think from here, kind of in practice, it was kind of clear that good supervision and also staff appreciation was really key in order to kind of continue working under transforming care. And then I guess for future research, I think it would be really great to hear the voice of kind of support workers in residential settings and their experience of supporting people who have moved from hospital back to the community. And also from the literature, there wasn't as much about the voice of family members and what it's like, the process is like for them from their perspective. So yeah, I thought that would be good as well. So I think that's everything.